Hi, I'm Dr. Ramya Narayanan, Strong Roots Dental. I have my colleague, Dr. Saloni Trivedi, here with me today. So we are going to talk about tooth extractions today and answer some of the most commonly asked questions. It is simplicity just to take the tooth out of the patient's mouth. There can be a few scenarios. It could be decay deep to the bone, deep to the nerve, where the tooth cannot be saved in the patient's mouth anymore. It could be a severe infection in the bone, where again, it's probably not safe to keep the tooth in the patient's mouth. Or it could be for orthodontic purposes, meaning, the patient's, that tooth has to go so that way the teeth can be aligned better, right? Or it could be a wisdom tooth extraction where the teeth are impacted, causing issues to the teeth in front. There could be several scenarios, but I've listed some of them. A root canal is one of the last resorts to save the tooth in the patient's mouth, correct? So if for whatever reason, after a root canal, the tooth is probably not savable because there's an infection in the bone and it's just not right for that tooth to be in the patient's mouth anymore, then yes, we would go ahead and recommend a tooth extraction. It depends on what the orthodontist recommends, right? Mm-hmm. If the orthodontist recommends that it's necessary, yes, then we go ahead and can extract it. It is not always necessary to remove. So your general dentist would recommend extraction of your wisdom teeth for a couple of reasons. It's impacted, but it's not completely in the bone. So then it's impinging on the tooth in front of it, right? One can cause decay on the tooth in front of it solely because it's hard to keep that area clean. So if something like that happens, then the dentist generally recommends that you go ahead and take out your wisdom tooth. Or if the wisdom tooth itself catches decay, can it be filled? Yes, it can be filled, but would you necessarily do a root canal on a wisdom tooth? Probably not. So then at that point, we go ahead and ask them to remove the wisdom tooth. These days, most of the general dentists are equipped to be able to do wisdom teeth extractions, but it entirely depends on your general dentist when they decide to refer you to an oral surgeon. Yes and no. So a periodontal disease can be cured by actually seeing a periodontist and making sure that the teeth, get the deep cleaning they require and all of the procedures that are recommended by the periodontist to be able to get back to health. Mm-hmm. So dental extraction, to your point, can it cure periodontal disease? Yes, if all the teeth are taken out.
Right. That's not always the goal.
That is not the goal, correct. Generally, yes. Again, unless you're congenitally missing a tooth, then obviously you don't need a tooth extraction because you've born without that tooth. You will obviously would have had a consult with your general dentist to decide why that tooth needs to go, right? And then you'll come back to see either the same general dentist or the oral surgeon, depending on what's decided between you and the dentist.
Right.
Then you will go ahead and get yourself numb, and then the oral surgeon will take that tooth out and give you instruction on what needs to be done. And you'll probably come back for a follow-up a week after to make sure the site is healing well. It depends on which tooth again, right? And also depends on the reasoning why the tooth has come out. So generally, one of the most common reasons for taking a tooth out would be some kind of infected tooth. So when it's infected and the bone around that tooth has also been infected, yes, we generally recommend some kind of grafting. So that way you take the tooth out, you clean the bone, you clean the infection out, place some new bone and let that bone heal and integrate with your existing bone. You will be numb. So the most painful part there is to get numb, which is most likely just a pinch, right? And then during the procedure, you should not be feeling anything. Having said that, you might feel, depending on the area where the tooth is being extracted, you might feel a little bit of pressure because you will have to keep your mouth open for some amount of time. But other than that, you should not have any frank pain. You might be a little sore for sure because it is a procedure that is being done.
Right.
Okay. So, but your dentist would have given you prescription antibiotics and medications to be taken before the procedure. So that way there's some amount of medication in your system while the procedure is being done and to continue it after until finish. Again, it depends on the kind of extractions. It can be completely impacted tooth or a wisdom tooth versus a simple extraction, right? But generally, I would probably say within 24 to 48 hours, the soreness will remain 24 to 48 hours, if that, and then after that, you should be fine. Again, your dentist would be giving you instructions after the procedure, but definitely making sure that you follow those instructions to the T is one of the best ways for it to heal at a much fastest rate. Correct. Yeah. So one of the instructions after tooth extraction is not to rinse or spit or drink through a straw, for example, for 24 hours. Right. The reasoning being you do not want the blood clot that is formed over the extraction site to dislodge. Right. Because if that dislodges, then one, you're going to have bleeding. And two, you will actually get into a situation where the underlying bone is actually exposed. And that can cause secondary pain.
Yeah.
So in order to avoid all of these complications, like I said, you definitely want to listen and adhere to the instructions given after the extraction. Again, definitely do not rinse, spit, or drink through a straw because it will cause dislodgement of the blood clot.
Right.
And if that happens, there is going to be exposure of the underlying bone, which can cause a lot of pain.
Right.
So if you do have pain onsetting 3 days after the extraction, please ensure to go back to the dentist. Yes, some amount of rest would be indicated after a procedure. Generally, once it's done, you take your medications, you eat right, and just sleep well that day. The next day, you should be fine and back to normal. Definitely, as soon as your dentist asks you to. So,
Right.
because when we ask you to schedule for an extraction or say that you need an extraction, so obviously there is a reason behind it.
Right.
So I would definitely not recommend waiting.
So I hope we've been able to answer some of your questions on tooth extractions and the process. But obviously, if any other questions come up, please do give us a call, Strong Roots Dental, and we'd be happy to help you.
Thank you. Bye-bye.